I'm joined now tonight by Andrew Miller. He's an LGBTQ+ education trainer with Denver Health. He teaches health professionals how to do gender-affirming care. Andrew, thanks for being here.
Thanks for having me.
If we could just break this out into two chunks, adults and then children, because there's kind of two different conversations happening here. When it comes to adults, if I walk into my doctor's office and say, "Doctor, I'm transgender," what am I now entitled to?
Yeah, so this new rollout of this benchmark plan that will take place January 1st, 2023 will make gender-affirming care an essential benefit for individual and small group plans. Essentially what this means is certain aspects of gender-affirming care, like gender-affirming hormones, certain gender-affirming surgeries like chest reconstruction, breast augmentation, facial feminization surgery, hair removal, will now be covered benefits under individual plans. Our hope is that this also means we'll be able to grow the amount of gender-affirming providers within the state of Colorado with the incentives coming from these insurance benefits.
Is there going to be in 2023, now that this is essential care, is there written into the guidelines a waiting period? Because I think most of us remember in the past there was this, significant counseling and screening period, sometimes years and years long. But now you hear many people say, I walked into the doctor's office and I walked out with testosterone that same day.
Yeah, so what we found is, a lot of healthcare systems are going to possibly do it differently, but what we're hoping folks do is follow WPATH, which is the World Professional Association of Transgender Health, their guidelines that they have continued to be putting out throughout the years. At Denver Health, we follow an informed consent model, which means we recognize as long as patients are able to understand the benefits and the risks of different medical procedures across the board, gender affirming or not, then we want folks to be able to access that type of care.
The American Academy of Pediatrics, my understanding is a few years ago, put out guidelines saying doctors should do gender-affirming care, which, to my understanding, and please tell me if this is right, because I think a lot of parents are wondering, okay, what does this look like? That it's not the wait-and-see standard of the past that they thought, okay, maybe this will change in the future. Now it's you don't question it, you don't push, you just agree.
So again, I think this is going to kind of come into the space of each health organization is going to be hopefully following similar guidelines. We let children experience gender and explore gender in a way that feels fit to them. And really what we want parents to know, our hope, is that parents can be connected with a medical provider and a behavioral health provider that can help navigate this experience with them and with their child in an informed way that, again, is affirming the family and is affirming that child's experience.
A lot of parents will run into this and think, what should I do? I don't want to hurt them by denying them care. At the same time, I don't want to hurdle them towards something that, might be too much. So when you're advising parents or doctors in that situation, what do you say?
Our main thing that we want to provide for youth who are exploring gender identity is support. And we want to normalize it, that folks are able to experience gender in a wide variety of ways. And for parents, what we want to make sure folks can do is get connected to credible sources. Within Colorado, Denver Health provides pediatric care. Children's has an amazing transgender and non-binary youth program. And again, when we can get families connected with medical and behavioral health providers, then we can make sure folks are able to follow an informed model of care, and again, being able to understand and normalize some of these experiences for parents, as well as hopefully get youth connected with other youth who are exploring their gender identity.
You talk about model of care, and that is something right now internationally that's being discussed. I think I was reading this in the Wall Street Journal, a column, and there's something called the Dutch Protocol, apparently. Started in the 1990s, I believe, to put children on puberty blockers when they get to that age, sometimes cross-sex hormones. But now several nations, including Sweden, where the Nobel Committee in Medicine, the hospital's located, and in Finland and the UK, they've all moved towards stopping this because they say a decade of data was showing that potential problems exist with sex organs down the road, or they don't find a reduction in suicidality or depression or anxiety, they say. So they're kind of backing away from this. We seem to be going in the opposite direction in the U.S. What would parents consider before they do move ahead with gender-affirming medicine?
You know, I think one of the main things that's important for me to bring into that discussion is I am not a medical provider. And so what we want to bring forward is the voices of medical providers who are following the research that is being done within the United States. And again, this is where I tell parents, we don't want you to ever feel like you're navigating this decision alone. And so rather, if this is a conversation that you're having, that's important for you to be having with your kiddos, make that appointment with your provider. Give us a call at Denver Health. Call Children's. Call medical providers and behavioral health providers who have done years and years of research on this. So folks can, again, make that informed decision and weigh those options together as a team rather than feeling like that weight is on themselves.
That's great advice, because every parent just wants to do right by their child, just wants them to grow up happy and healthy and flourish as an adult, whoever they are. Andrew Miller with Denver Health, thank you.